All right, so imagine you're dealing with a disease 3 months after it first hit. That is the reality for a lot of people these days living with long COVID, which is a post-acute syndrome associated with people who have been afflicted and diagnosed and treated for COVID-19. And I want to have a conversation today about long COVID, one, because as we move further and further away from the origin or the initial onslaught of the pandemic, we start to learn more and more about the disease. I was telling people, especially if you've been following me here on the channel for a long time, especially when we were in the middle of the pandemic, it was going to take a while for us to start being able to have enough information just to figure out, hey, what is this disease that we're dealing with? More importantly, how long are we going to be having to deal with it, right? I remember I telling people this is going to be for life, right? COVID is going to be a thing that is not going to like disappear after 1 summer, 2 summers. It is going to be here, and it's likely going to change the way that we operate, that we live, that we practice, especially if you're in healthcare, for our lives. Few years down the line, that theory still holds true. So I do want to kind of give a highlight on this aspect of long COVID, especially in the early stages. There were patients and communities that were kind of growing on social media saying like, hey, you know what? I got diagnosed with COVID 2 months ago, 3 months ago, 4 months ago, and I'm still dealing with the symptoms. And the reason why they started growing these communities, especially online, is that they were running into a lot of healthcare professionals who didn't believe them. I want y'all to think about that. They were running into healthcare professionals who didn't believe that they could still be experiencing the same symptoms and same sequelae, if not worse, months down the line. And this is one of the things when I talk about COVID versus flu, and people try to, especially those who are, anti-COVID, try to equate the thing. I say, there are some things that you would never have to equate with flu that you are going to have to equate with COVID. And this is just one of them. So it took 1, 2, 10, 20, 100. It took thousands of people to start kind of growing in communities for us, especially from a healthcare perspective, to start recognizing like, hey, you know what? This COVID isn't one of those things where even if you have mild symptoms when you first get afflicted with it, it isn't something that just necessarily goes away in everybody. I want to make sure, and I want to give those communities, especially those early communities, a shout out because they were not heard. They were not seen when they were just kind of calling out for help. And as we continue to learn more about what COVID does and what other body systems that it affects, it becomes clear as a day that this is a disease process that not only can be severely debilitating, but life-changing for a lot of people. And that's for the people who are still here with us. We already know the numbers. I could put plenty of links to prior episodes where we talk about some of the numbers of people who passed away from COVID, especially in that first year or two, right? The numbers are there. We don't have to talk about the facts that, yes, it has killed more people than the flu has done in its entirety, right? And it did that in like a 2-year span. We don't have to keep bringing these numbers up because now we start looking at the people who did quote unquote survive COVID but still dealing with COVID, right? I wanted to make sure we got that inference down because I know for a long time, because I used to hop on these groups and hop on their lives, for a long time these people weren't seen when they'd be complaining about still feeling short of breath, still feeling winded, having issues like rashes that come around, memory changes, like all of these things that you're like, well, you just had COVID. Why do you have skin rashes? Why do you have memory changes? Why are you having memory fog? Like, why are all of these things kind of popping up? It is because at that time, again, we did not know just how effective COVID was at damaging our body system. And it unfortunately is the inflammatory reactions associated with COVID. Again, that's not necessarily here for this episode. Let's talk a little bit about the numbers and again, sequelae, just to give us an idea of, the effects of COVID. All right, so before we start getting into the numbers, I just want to kind of give you the CDC's definition of long COVID, just so we have an idea. According to the CDC, long COVID is a term that encompasses a wide variety of symptoms that persist for weeks or even months after acute infection. These symptoms can affect multiple organs, systems, ranging from respiratory, cardiovascular, neurological, and gastrointestinal. Symptoms include fatigue, shortness of breath, brain fog, muscle pain, persistent cough. There are some reports out there that you can have not 10, not 20, you can have up to 200 different symptoms that fall under this umbrella of dealing with long COVID. 200. So imagine, again, if you're a healthcare provider, again, especially for my healthcare providers, one of the questions you have to ask, especially if you have a patient who just comes in with these constellation of symptoms that you really can't put one and one together. One of your historical questions you have to ask is, have you ever been diagnosed with COVID? When was the last time you were diagnosed with COVID? That has to be a question in our armamentarium, because if you don't ask that, if you're not thinking about it, you don't even kind of go down this road. And here are the numbers here, right? Just for those who may not understand, 10 to 35% of people who suffer an acute COVID infection are at risk for developing long COVID. 10 to 35%, right? 17% U.S. adults have experienced long COVID, with about 7% currently receiving treatment now. That's just kind of current numbers here in the United States, right? So just to give an idea, you have a disease process that is a sequelae of an initial disease process that lasts longer than 3 months, and the range of symptoms that you can actually be afflicted with number up to almost 200. And I always think about those groups early on who fought with their healthcare providers and who had to go to second and third and fourth opinions because no one believed them, because their symptoms didn't make sense. And now that we know years later, and we're still learning information, we are still learning information as we speak, that there are up to 200 symptoms that are arranged as a constellation that could say, hey, you know what? I think you may be dealing with long COVID, right? It's just one of those things where we really have to, gonna have an open, eyes and ears for our patients, because it is clear that your patients aren't making it up. It is not in their head just because they had COVID. This is real, and the numbers are starting to show it. All right, so let's talk about some of the risk factors associated with long COVID. It doesn't guarantee that you will develop long COVID symptoms, but does put you in a box where, all right, this is a person that if they came into my office with, a varied range of symptoms that I have to be wary of. Being a woman has been found to have a higher propensity to develop long COVID, just being a woman. Obviously, our older patients, when I say older, 35 and up, 35 to 50 range is where we're seeing a high propensity of our patients with long COVID. And it does not help if you dealt with prior health issues before, whether it be hypertension, diabetes, high cholesterol, thyroid issues, osteoarthritis, rheumatoid arthritis, any autoimmune related aspect, right? If you dealt with some health complication and then you get afflicted with COVID, you do have an increased risk of developing long COVID. More importantly, those who suffered a severe case of COVID when they first got it. So again, there's some people, they got COVID, didn't even realize they have it. Can you get long COVID? It's possible. But those who got COVID, had to take outpatient medication, might have had to take inpatient, hospitalized for it, you are definitely at an increased risk of developing long COVID and long COVID related symptoms. That's like the basket category that I want us to think about. If you're concerned, especially as my patient, if you're concerned, all right, is this still COVID? Can I still really be dealing with COVID? And think about, all right, do I fall under this, kind of umbrella? Again, not to say that if you fall outside of an umbrella, you can't have COVID, but falling in that umbrella, being a woman, having health complications prior to it, dealing with a severe case of the COVID-19 when you had it, being at age 35 to about 50, right? Those are risk factors that put you in a bucket, that put you at a higher risk of dealing with long COVID. And for right now, which is probably something you don't want to hear, there really isn't any diagnostic criteria, aka there isn't like a lab test or an imaging study that I can order to say, yep, you have COVID. So a lot of it is being able to talk to your patient being able to voice their issues, their concerns without feeling any fear that, they may be looked at as making it up, as something that's just in their brain because the symptoms seem so out of left field. So having a good conversation, a good rapport with your patient is going to be first in line to, help diagnose a patient with this syndrome. And because again, there is no test, right? And more importantly, because there's no test, there really isn't a one-stop treatment option either, right? Because again, we said 200 symptoms. You can have 200 symptoms associated with disease. So there are aren't really any one particular treatment that's going to treat all 200 symptoms. So it is up to the healthcare provider, just based off your symptoms, to kind of figure out, all right, which treatment options do I have available for me now that can deal with the symptoms that you're dealing with. And it's unfortunate to say that it does not mean that the symptoms will go away. It just means that the symptoms will be managed enough so you can really just go about your activity of daily living. Because in any disease process, we know one of the biggest factors that draws a person to come to the office, the clinic, the hospital, is how is this affecting my current activities of daily living? Like, if I can only walk 5 or 10 feet, I'm going to go see someone because I can't breathe. But if I can, I'm cutting a jig, nothing's really stopping me, no symptoms whatsoever, right? Like, yeah, it's gonna be a longer time for me to actually seek professional help. So understand, by the time your patients are coming to see you about this constellation of symptoms, they've tried things at home. No one wants to see a doctor, but most people have to see a doctor. So once they get to that point where they have to come see you, they don't want to hear that the symptoms are in their head. They don't want to hear that the symptoms will kind of blow over, because they've been dealing with this for months. They've been told for months, hey, your shortness of breath will get better. Hey, your symptoms of sleeping and GI issues will. They've been told that for months. And they look at the calendar, 3-4 months have gone by, and they're still dealing with the same issues that they dealt with when it first began. So make sure we are very understanding and listening to our patients, right? Remember, we talked about this, as a healthcare provider, right? You got to be almost like a coach. You got to listen to the star player talk, right? So if the star player is saying, hey, something is wrong, I've been dealing with this, I've been trying, I'm here because I need help. Understand them, reiterate what their issues are, and then try to kind of, again, at least lead them to this aspect of, hey, I think I know what's wrong. Because if you tell a person, hey, I don't know what's wrong with you, I'm not sure when this is going to get over with, but take this medication here, they're not going to have the trust in you that you're actually taking care of them. But if you say, hey, you know what? It sounds like with all of the symptoms that you got and you're dealing with, you might be dealing with long COVID. And I want you to understand that dealing with long COVID doesn't mean that it's going to go away. Even if I give you some medication here, my goal is to obviously help treat your symptoms, but this may be something that becomes a chronic issue. So understand that just helping your patients along their journey of just understanding, hey, what am I dealing with? Don't have to go online, right, to find, random people to say, hey, I'm dealing with these issues too. What do you guys think, right? Because that's what happens. That's what happens now. Just in case, hey, my healthcare providers, I don't know if you know this. A lot of people, a lot of your own patients are seeking help online because they don't think you can give it to them. A lot of people are watching, my channel, or they follow me on social media, or they read my blogs because they understand that, my provider can't help me, but for some reason, Dr. Barry Pierre seems to have the answer. Shout out to me, but more importantly, y'all got to get it together, right? So that's the conversation today about long COVID. Again, I wanted to make sure that it got its just due, that we're continuing to highlight it and understand that this isn't a conversation that's going to be a one and done, especially as we continue to learn more information about long COVID and the symptoms and the people who it typically affects. We're going to have more and more data to be able to kind of arm our healthcare providers and, more importantly, our patients with the information to help along their way. Because that's all it is, right? We got to help our patients along the way. Remember the motto, empower yourself for better health, right? So I hope we got a good little informal setting discussion on what long COVID is. Again, I want to shout out all of those groups who have been dealing with long COVID and unfortunately have had to deal with it alone until, science and medicine caught up to understand, hey, this is what we're dealing with. I'm yours truly, Dr. Barry Pierre, and I'm going to see you guys next week.